Hi, my name is Erin Ellen, and my presentation will capture the knowledge I have gained throughout this past semester in ethics in healthcare. I firmly believe the content in this course has made me a better clinician and has challenged me to self-reflect and gain a new perspective on ethics in healthcare field, ultimately influencing my actions in mitigating unethical behavior in my clinical practice and organization, as well as bettering myself as a person and a professional. I will first summarize the content I have learned throughout this course and provide an overview of how I've grown as a professional within the interprofessional healthcare team. As we know, challenging decisions and ethical dilemmas are commonplace within the healthcare field, as we are working with multiple individuals within the interdisciplinary team and with various patients. Therefore, values and morals can become skewed by the views of other providers, which can lead to unethical behavior. I believe it's imperative that we learn about ethical principles, but also the strategies to implement moral thought and ethical action into our clinical practice and personal life. So during this course, we completed self-evaluations to determine our personal and professional values and personalities. Our values are the principles in which we find critical or hold in high regard compared to other aspects of our lives. Our values influence our choices, actions, and behaviors, which ultimately provide a foundation in which we build our character and integrity. Integrity and character are significant contributors to our ethical decision-making skills within the healthcare realm. Collectively, the principles of integrity also influence how we collaborate with other healthcare professionals within the interprofessional team. So during our self-evaluations, I discovered that I value relationships, hard work, and harmony, which directly influence how I handle conflicts, interact with individuals, and approach challenging decisions. I have learned these values through a combination of both family principles and life experiences, which have provided the foundation of my moral compass that guides my choices and actions. Now, how I choose to act and behave throughout my life in clinical practice determines both my personal and professional character, because my morals are unique to me and directly influence the consistency of my actions and behaviors. My character defines who I am and determines the person I aspire to be. Therefore, it is essential to establish both my values and morals before making ethical decisions to stay true to my character and authentic self, ultimately decreasing the risk of committing an unethical act. Now, coworkers and administration can influence how I view my morals and beliefs, as they may have different perspectives or ask me to behave in a manner that does not align with my moral compass, which may cause tension and lead to essentially difficult professional and unethical decisions. If I consistently stray away from my values and act in a consistent manner that negates these beliefs, I am not fulfilling my desired personal character trait and may lose my true self, leading to frustration and burnout. Situations like this occur all too often within the healthcare profession. Therefore, it's essential that professionals make an honorable choice when faced with an ethical dilemma and consistently behave in a manner that aligns with their moral compass to increase both personal and professional satisfaction. Now, healthcare professionals make decisions daily to determine the best care of their patients, and each of these decisions is directly influenced by a person's values, morals, beliefs, and character, as these principles guide the person to achieve the most ethically appropriate choice. An element that directly influences ethical decision-making is egoism. Egoism is defined as a philosophy of ethics that considers benefit, pleasure, or the highest good for oneself as the primary goal. Egoism maintains that individuals have a moral duty to protect oneself and are the most capable of looking out for themselves. Individuals who also maintain a self-serving bias, which permits individuals to make decisions that best serve them or provides them with the least amount of loss. Healthcare providers must consistently consider egoism and self-serving biases as they encourage healthcare professionals to make unethical decisions or act immorally. To ensure that ethical practice occurs, healthcare providers can perform self-reflections before, during, and after challenging patient cases or decisions to examine how these choices and actions have influenced their ethical decisions. Reflective practice is the process of learning through and from personal and clinical experiences to promote new insight of oneself and/or clinical practice. So reflecting on oneself and actions within clinical practice encourages individuals to become self-aware and critically evaluate personal responses to these challenging situations, which allows clinicians to adopt a thinking approach to their clinical practice, which I believe will decrease unethical actions, improve patient outcomes, and job satisfaction. Ethical reflection includes reflection before, during, and after action, Reflection before action includes reviewing our past experiences, whether that's personal or a coworker's experience, to improve a current situation. Now, reflection in action requires the clinician to examine their experiences and responses to a challenging situation as they occur. And then reflection on action or after action requires clinicians to review, analyze, and evaluate their past practice as an approach to gaining a new perspective or insight to enhance future practice decisions or actions. Now, ethical reflection, during these 3 stages in clinical practice will enhance clinical competency, and reflecting on one's actions following a case, regardless of the outcome, provides a significant learning experience. So addressing potential challenges can assist providers to avoid inappropriate choices and unethical actions. Now, when individuals experience an internal conflict between one's morals, emotions, and cognition, moral distress can arise. Unfortunately, moral distress is present in all healthcare professions in some capacity. Therefore, it's imperative mentors introduce ways for students to approach ethical dilemmas to decrease frustration. Prior research highlights the need for implementing professionalism, empathy, and humanism through strong mentorship as a means of protection against disdain in students entering the healthcare profession. Educators, mentors, and clinical supervisors are essential components to generate moral, competent, and empathetic professionals following their educational careers. Therefore, healthcare professionals must create a mentoring plan to decrease moral distress and create empathetic clinicians through educational strategies to facilitate ethical practice within interprofessional teams. In addition to mentorship, socialization is an essential component to learn about organizational culture and can also influence professional behavior. Healthcare professionals socialize as a means of learning to behave in a way that is acceptable within the professional organization. Socialization also invites professionals to share their knowledge, skills, perspectives, attitudes, values, and then perceptions of their skills and values as well, which will influence interprofessional practice. And most importantly, socialization consists of individuals' expression and how one manages their emotions, especially when they're experiencing a challenging dilemma. The manner in which healthcare professionals socialize directly influences how healthcare providers act within an organization. If socialization creates a values conflict, provoking moral distress, there's a risk of embracing unethical practice. And moral distress frequently occurs in clinical practice due to the inherent moral activity involved with treating patients. Ethical decisions in healthcare are inevitable, especially in interprofessional healthcare teams, as professional values and policies are very unique. For an organization to uphold morality during tough decisions, the organizational leaders must strive to understand the values and intricacies of ethical leadership to ensure all professionals within the company are promoting ethical practice to increase patient safety and decrease litigation. Ethical leadership is imperative within the healthcare organization to provide a moral foundation and guide employees through challenging decisions to provide high-quality patient care while upholding a professional business at the same time. So to combat the inevitable unethical behavior that occurs in healthcare and reduce moral decline, it's advantageous to develop a leadership philosophy. And I believe organizational leaders should employ both transactional and transformational leadership to establish a moral foundation without promoting unethical behavior. Now, transactional leadership focuses on the performance of the organization, the supervising leaders, and interprofessional team. Transactional leadership is beneficial to formulate a leader-follower interaction and create an exchange process that will appeal to the leaders' and followers' self-interest. I believe if leaders incorporate transactional leadership by hosting paid clinical meetings for ethics training or bonuses for self-evaluations of ethical behavior within the clinic, this can motivate employees to consider their values, morals, and behaviors. And as I have already mentioned, this is significantly important to self-reflect for ethical practice. Now, encouraging employees to reflect on their ethical decision-making processes can invoke a change in organizational views of the significance of ethical behavior and also provide a moral foundation in which transformational leadership can enhance. Transformational leadership is based on moral standards and views of ethical policy and procedures as a priority and consists of 4 separate components, which are idealized influence, inspirational motivation, intellectual stimulation, and individualized consideration. These provide followers with the means of motivation, addressing challenges, providing both questioning and solutions to these questions, and learning opportunities. And it also makes a leader set an example to the followers by applying the same ethical principles to themselves as they do to others. Now, to be an effective ethical leader, one must employ both leadership strategies to ensure that organizational members uphold their professional and moral responsibilities within the clinical practice. Employee and patient satisfaction will increase in ethical dilemmas as they are identified early to reduce moral decline. Now, throughout this course, I have learned valuable knowledge and strategies to improve my ethical decision making. And I believe that ethics education is not about teaching you how to be ethical. It's about learning to make better decisions. This statement could not be more true regarding my growth over this semester. Ethics education does not directly teach you what is right or wrong or good or bad. Instead, it teaches you to self-reflect on your past experiences, to determine what could have improved, to decrease loss for either you or others, or to improve patient care. Ethics education provides you with the means and knowledge to learn about yourself and critically analyze how and why you act the way you do, or how you derive to your personal and professional character. Ethics education builds a moral foundation that will influence how you approach challenging situations, ultimately helping professionals make better ethical decisions rather than providing just the answers, like I said, of what is right and wrong. Ethics education provides the strategies to reach the solutions to these ethical dilemmas we face in healthcare. And I have conducted consistent personal reflections when I encounter difficult situations to assist in my ethical decision-making process since taking this course. Prior to this course, I honestly spent little time considering my morals and values and how they influence my clinical practice decisions. Also, I have gained a better understanding of the influence of moral distress and how it drastically influences my moral integrity, which can lead to professional burnout. I have experienced ethical dilemmas in my current and previous clinical practice settings, and as a result of this summative project, I feel I've gained significant knowledge of myself and personal values to approach these decisions with a new perspective and powerful strategies to guide me to the appropriate decision. I now understand the influence interprofessional team members have on how I approach clinical and ethical decisions. I feel confident that I have established a strong moral compass that will guide me through any challenging situation. And when I feel stuck in these dilemmas, I understand the importance of socializing with other healthcare professionals to further assist in my ethical decisions. I understand that everyone holds unique values and may act differently due to their various life experiences and perspectives. However, it is crucial each healthcare professional hold true to their character when making ethical decisions. I feel I have grown the most in my ability to self-reflect on my past experiences to enhance my future clinical practice, as this ethical strategy has provided me as an essential component to making my better decisions. Also, employing this concept into mentoring and ethical leadership is imperative to lead others through ethical dilemmas. Unfortunately, ethical dilemmas are commonplace in healthcare, and they will continue to occur, yet knowing various strategies and principles to assist in the way I approach these situations has made me a more confident and satisfied clinician. So I'm very thankful for this course. So thank you. And here are the references I've cited within this presentation. Thank you very much for your time and attention.